Look at this. Hello, everyone. And welcome to the Health Equity Forum. What an honor it is to be here at the United Nations with all of you. It really is a dream come true because we know we have tremendous challenges when you talk about health equity. Achieving health equity is a monumental task with lots of complexity. And it is through collaboration and the magic ingredient of collaboration that we can truly have transcendent change. And that's why we're here. We're here because we want to support the United Nations Sustainable Development Goals, specifically with a focus on good health and well-being and reduced inequalities. And everybody here has a significant challenge because this is not simply a get-together or a reunion. This is intended to be the beginning. Today is just the beginning of a challenge for us, a movement for us to step up and recognize that through partnerships and through alliances is the only way that we can truly move the needle when you're talking about the complexities of social determinants of health. It is a multi-dimensional challenge that requires multi-dimensional perspectives and players and partners. And that's the focus and the energy that we want to create with the Health Equity Forum. This place is for all of you to be able to meet and greet other thought leaders that share that common passion, that common goal, and that common mission. But it is not just to talk, it is to create action. So I invite every single one of you guys to be intentional. Be intentional about the relationships you make. Be intentional about the way that you can collaborate. Let's have the empathy to recognize that together we can, and we can do much better things together. It is an honor for this to be the inaugural event of the Health Equity Forum. But remember, this is only the beginning. So I hope that I get to see and collaborate with you guys in this journey. Thank you for joining us here today. And with that said, I want to introduce the chairman and founder of the PVBLIC Foundation, a good friend and a partner, Sergio Fernandez de Cordova.
Well, welcome everyone. Welcome to the SDG Media Zone. I'm really excited to have you guys, have everyone here. When Enrique and Lily, were mentioning wanting to do something in health and really bringing leaders in the health space and creating a health equity forum and really to launch it at the United Nations, it was something that as soon as they came up with this vision, it's like, yes, we have to do it. We have to do it, and also we have to do it during the General Assembly. We have to actually start the conversation, create the narrative, and start to bring leaders, and not only bring leaders from all parts of the healthcare space, health space, but also bring folks from the government, right? Folks from civil society, multi-stakeholders to actually start to really bring the conversation together because we really need everyone to start focusing on this. Obviously, we just had a terrible last few years, a pandemic, and it's really brought a lot of attention to the space. We need more technology. We need more universal health care. We need access. And, this is what a better place to do it than at the SDG Media Zone. So we're really, really excited to finally see this vision become a reality and excited to be a partner here. And I'd like to welcome Mr. Amir Dossal, who's been a mentor, a friend, a brother for more than 10 years. Amir Dossal was basically the man that helped create the office for partnerships at the United Nations. And basically, ever since he's created the office for partnerships, SDG 17 is really everything Amir Dossal embodies. And to us, this is when we look at Health Equity Forum, and obviously he'll give you a background on what he's doing in health. 17 and partnerships is at the core. Without it, we're going nowhere. Thank you.
Good evening, everybody. A very warm welcome to all of you. And I have to thank Sergio. I paid him a lot of money to say all these nice things, actually. Partnerships. I want to start by thanking not only Sergio, but Enrique and the team for putting together this very important discussion. In case you didn't know, the UN is hosting 3 different conversations this year on health. Universal health coverage, pandemic preparedness, and TB, which takes place tomorrow. And the Secretary General put out some stark statistics today. he said that there are 4.5 billion people who really do not have access to proper health services around the world. So here we are. We're thinking of addressing the SDGs. The SDGs are struggling. Only 15% have been met up to now. So the only thing which ties the SDGs together is health. It's a no-brainer. If it's better health, a child will grow up better, learn better, and earn better, and become a member of society. And when you think of the word equity, equity means different things to different people. But actually, it's equity in terms of public health. It's equity in terms of medicine. It's equity in terms of delivery services, providing the right frontline health workers, and so on. You all know what happened during COVID. Those who were fortunate, who lived in the West, got the vaccines. The developing countries did not. And one of the biggest challenges they faced was the lack of an adequate supply chain. Second, lack of adequate cold storage, and so on. So you people in the room, those who are watching, we invite you to be part of this new movement. And I would encourage you to work with Enrique and Sergio to see how you can pool your efforts together. You don't have to always say that I must put money into this bank. What you need to do is pool those efforts and put it under one umbrella. You'll inspire many others actually in this process. And by doing so, we might actually have a chance of tackling not only health, but education and poverty. So I wish you a very successful event, actually. And I'm part of the PVBLIC family. My full name is Amir Fernandez de Cordova. And I want to thank you all for being here. Thank you.